My name is Suhrob Abdullov. I'm from Tajikistan. I have the problem with my eyes from my childhood. By year, my glasses is become bigger. I have heard about the Eye7 from my colleague in Tajikistan embassy. He recommended me to check my eyes if it's possible because I have a good chance to come in India to put in my eyes lens, and lens is good options. Two of my friends also did in Eye7, and I hope that after the surgery I will remove my glasses, and I hope that I will become healthy and powerful. Problems is with my eyes. Without glasses, I can drive a car in the night. Nowadays, I can see the far. First time when I came to Eye7, they checked me my eyes. I spent more than 4 hours, and after the decision, Mr. Sanjay Chaudhary they told me that this lens came from Switzerland because India is importing it. I said I will wait. I have 4 days here. Now today I have a surgery. Also, I want to tell that this is my second visit to India. First time I've been in South India in Hyderabad for eye-tech course. It's a good chance to be in this historical country. It has the ancient history, Tajikistan culture with Indian culture. We are the same. I love this country. I hope that maybe the representation of Eye7 will open in Dushanbe in Tajikistan. After the surgery, I hope that my sightseeing will become healthy. I saw with my own eyes the Taj Mahal, the beautiful place, and I will draw my glasses to draw again.
So I'm Dr. Sanjay Chaudhary here from Eye7, and we have a privilege of entertaining and looking after our guest, Suhrob Abdullov. He is from Tajikistan, a diplomat to India. He has a little spectacle power which he has been using for quite some time. We have worked out a system for him by which we can give him relief from his glasses, and what we are using is a ICL. So there are two ways for vision correction. One are the laser based technologies in which it is Contura, and one are the lens based technologies in which the best lens is the ICL. The ICL is made in Switzerland, is imported to India, and then we use it in our Indian clientele or our guests who come from abroad for this treatment. In India, the medical treatment is comparatively more friendly compared to European and American cities and the countries. We have what is called a lot of medical tourism which is coming into India, and Indian doctors, because of their large volumes which they handle, are known for their surgical skills. So it's a combination of surgical skills and a user-friendly price that attracts a lot of people from other countries into India. Is that right?
Yes, right, sir.
Okay. We are just going to put some eye drops in the eye. So just under numbing eye drops, we are going to perform this procedure, and this procedure is painless. The name of my surgical assistant is Amrish, and he is an OT technician for the last 20 years with me, and he is such an expert that we will watch during the surgery. I don't even have to say a single word. Automatically he will place the right instrument in my hand, and he'll have everything ready, and the whole procedure should barely take about 5 to 6 minutes. The temperature in the OT is 23 degrees and the humidity is 43%, which are just ideal conditions to start the surgery. So we are doing the right ICL,
Then left, yeah?
then left. So this is the ICL in my right hand, and I am loading it onto the injector. So the lens is loaded, and I am now ready to insert. So I am in position over the eye and ready to start the insertion process. Here is the ICL going into the eye. It's gone, and now I'm tucking the lens into position, technically what is called behind the iris in the sulcus. Both the haptics of both the supports are now in position. My actual surgery is done. Now I'm just in the finishing steps. So those little small entry points which I made, I'm going to seal them, of course not with stitches, just with a special fluid. So the whole procedure is also stitchless. I inject a spot of antibiotic, which is moxifloxacin. My surgery is done. No pain?
No pain.
Great. So what we do is simultaneous sequential implantation. That means both eyes together, one after another. And now we are preparing ourselves for the other eye. So now we have what is called a toric ICL in the left eye, because there is a little cylindrical power in the left eye. So we will also be correcting the cylindrical power with the spherical power. So these lenses are called toric lenses. The power in the eye is -6 with spherical, one cylinder at an axis of 20 degrees. So this is the power we are going to correct with the ICL. These are the base level marks which have been projected on the eye. This data has been collected 5 stories below in a machine, and then that data comes here automatically through cables into the system which you see there on the wall, and from that data it is projected through a camera onto the eyes. So registration done, this is what it is showing. So this is where I'm going to first mark the eye with a dye which will leave its effect on the eye for the next 1 hour. So the axis is marked. You can see those marks on the eye in the camera. And now we proceed with loading the lens. So first the entry points. So these are micro entry points, self-sealing, through which the ICL goes through into the eye. And the ICL comes in this sealed condition in this bottle. I'm taking it out of the bottle, putting it onto the cartridge. So loaded onto the cartridge and now loaded onto the injector. The lens goes into the eye, aligning it into position, and now tucking it into position. So this shows it is still about 2 degrees off. So I'm going to rotate it just 2 degrees more. And now the lens is bang on into position, exactly matching the 17 degree marks. Are you okay?
Yes.
So we are finishing, closing the small little entry points. Both eyes happened in about 15 minutes, and we did not use any injections. We have put both the lenses in both your eyes.
I can't feel any hurts. It was nice. Thank you very much for your doctor, for your hard work that you have done for me. From my childhood, I was wearing the glasses. After the surgery, I will draw my glass.
Okay.
The health is very important.
This is the latest technology in the world on how to correct vision with lenses, and this is what we have used, and you've seen that technically once the technique is mastered, you need a lot of gadgetry, a lot of equipment, a lot of know-how, but in the end the procedure time is short and the procedure is very smooth. Can you see a little bit right now?
I can see.
Yeah, you can see this.
And the site will restoring, yeah?
Yeah, so right now he can see everything, but naturally a little hazy because the eyes have just been operated. There is no bandage on the eye right now. the vision will improve in about half an hour's time, and by tomorrow morning his vision would be crisp in both the eyes. Tomorrow morning.
Okay.
Right, so right now we'll let you rest for a while, and then I'll have a look at you again in the OPD, say after 1 hour.
All he has done for me after surgery, I'm feeling very, very, very good. Without glasses now I can see most like 100%. The doctor said after 7 days I will become more healthy, and he is very kindness, a very good person. Now it's for 3 days I'm coming for checking to my eyes, to my vision. I'm feeling good. Without glasses I can see 100%. I'm feeling good. I'm powerful.
So now we are checking your vision. Can you please read?
D R H
Now?
H Z C
Yes.
K S F R
Yes, now?
P U V F E C U R S K C H T.
Yes. Congratulations, sir. You can now read 6 by 9 without your glass also.
What I want to say to Eye7, thank you very much for all staff, especially for Dr. Sanjay Chaudhary. That was very amazing, and I can say Eye7 has modern equipments. I can say it's #1 in India.